Hello and welcome to our business proposal, Stop Suicide Rates Intervention. In 2020 to 2021, 23.7% of adults reported evidence of depression or anxiety, an increase from 2019 to 2020, which was 21.7%. The mental well-being scale in 2018 to 2019 was 24.3 out of 35, compared to 25.3 in 2015 to 2016. With the higher the scale, the worse the mental health well-being, with COVID increasing requirements for antidepressants, costing the NHS £139 million throughout the whole pandemic. In 2021, prevalence of depression in Wakefield was 13.6%, a 3.5% rise from 2017. Then in 2018, Wakefield had the highest female suicide rate. When considering over half of newly diagnosed patients don't receive a review, which increases the risk of suicide, resulting in the unresolved antidepressant-related problems and overprescription for those who began therapy, which negatively impacts prognosis.
SSRIs and SNRIs are the most prescribed class of antidepressants in the UK according to the NHS. In 2021-22, the NHS BSA recorded a 5% increase in antidepressant prescribing. While services such as the New Medicines Service and previously the Medicines Use Review have existed for other medicines, there is no current service pertaining to the management of antidepressants. This is where our service is needed. Both the NICE guidelines for depression and summary of products characteristics mention suicidal ideation as a common side effect at the start of antidepressant therapy. Without the correct guidance and support mechanism, initial stages can lead to medication non-adherence, worsening depression or suicidal attempts. 51.7% of patients newly diagnosed with depression in Wakefield fail to have a review after 10 to 56 days post-diagnosis, highlighting a significant use within the community. Our overall aim of the service is to reduce medication-induced suicidal rates in Wakefield, to help patients to manage the antidepressant side effects, to reduce the burden on GPs to help to reduce appointment waiting times, and our general aim to promote mental health support to the general public. The service will be exclusively for adults in Wakefield who are 18 plus and who are registered with a GP in Wakefield. This service is primarily for patients who have been newly prescribed a SSRI or a SNRI for depression, or have had a dose adjustment to the antidepressant medication.
Service outline. Eligible patients can be referred by GPs, charities, self-referral and identified by pharmacy staff. It's on the depressive symptoms and suicide ideation. Also discussing new medicines and any concerns. A follow-up consultation is done 7 to 14 days after the initial to monitor patients' adherence and allow patient questions. An optional third consultation within 3 months to continue the support with patients' medication.
How will we market the service to our patients?
Here are examples of our adverts and posters, which will be posted on different platforms around Wakefield, informing patients about the service and what to expect by scanning the QR code. This will allow patients to search for their closest pharmacy to access the service.
There are previous studies that have piloted similar services across the globe in places like America and Australia that have received good outcomes and feedback which could be implemented here in the UK.
Who will run the service? The service will be run by pharmacists and qualified technicians in community pharmacy settings. Pharmacists and qualified technicians will undergo online training consisting of 3 core modules. A 70% pass mark is required to carry out the service. The remainder of staff will read an SOP and all training is repeated on an annual basis to retain accreditation.
Variable costs depend on the degree of output from the service, whereas fixed expenses are mostly used to support training for such a service. The costs of the service are minimal overall. Please see the business procedure document for further details.
2 months, 3 pharmacies are inducted and staff are recruited and introduced to the specifications and protocols of the service. In preparation, staff undergo training and receive 5 patients per pharmacy whilst hosting online engagement events. Month 5, service is launched. 6 months onwards is adjusting the service from feedback and audits to re-establish the amended service. After year 1, evaluated based on patient outcomes, suicide rates and feedback. Wakefield, we care for your welfare. Thank you for listening.